Thanks very much for that, Stephen. Okay, when I imagine my hopes for healthcare, I start by thinking about where we came from. I think about the spirit that was alive throughout our country when those great minds envisioned a universal, publicly funded healthcare system, like caring for our neighbors when they're in need and making sure that everyone has access to high-quality services. And I wonder if that spirit is still accessible today. I also wonder what it meant to be a healthcare professional. Did the people who went before us have a different sense of purpose? Did the privilege of caring for others ignite their values as individuals? Did they have passion for their work, and did it bring them joy? And what about us? Do we experience joy and share the same passion? Do we still hold in high esteem the privilege of looking after those in need? You see, my fear is that the spirit that brought us together and the passion that fuels our joy has been overshadowed by fiscal pressures, increasing demands, the pace of change, and even the technology that support us and our patients. As a system, do we know what we're trying to achieve anymore? Some days it feels like we've lost our compass. Imagine if we could reignite that spirit and rekindle the passion. Imagine if every staff member came to work every day feeling tuned into the spirit of their profession, feeling the joy of knowing they work for an organization that cares about and supports them in the important work they do. Imagine if we had clarity of purpose and laser-like focus on system priorities. Imagine that could make to our patients. So my first hope for healthcare is that everyone who calls health their home will have a renewed sense of purpose and find joy in the privilege of being caring professionals, and that as a system, we will gain clarity in that purpose and focus to execute. And what if the values that brought universal healthcare to life were still talked about and embraced today by both health leaders and citizens? What if they lived today as they did in the past? Imagine if we could infuse those values like solidarity and equality into everything we do going forward. My second hope is that our Canadian healthcare values will inspire us to move boldly into the future. Our reality is very different today. The challenge is that people live longer and have much more complex needs. Costs have escalated, and the services available have grown by astronomical proportions. Decades after founding universal healthcare in Canada, the way forward demands new vision and the courage to be open to new possibilities. Inspired by our founding values, imagine what might happen if we started to think of patients as our partners in this challenge. What could they bring to this new alliance? Are they simply people who need us to care for them, or a resource to be cultivated and actively engaged? Let's tap into their wisdom. Imagine if we could do to healthcare what the banking industry did to personal banking a decade ago. Can you remember lining up at a bank teller between 10 a.m. and 3 p.m. Monday to Friday just to find out your balance or deposit your check or make a withdrawal? Think of your last hospital or doctor's visit. We're still very much like that. Isn't it time for change? The banks listen to their customers, reimagine their services, and today we've gone from being simple consumers of banking services to being informed, knowledgeable, and actively involved in managing our personal finances. What if we could make that kind of shift in healthcare? Imagine if we could create tools for our patients that not only allowed them to access their information, but help them to make sense of it too. Imagine if they could log on to their very secure, unhackable personal site that made it possible for them to understand how decisions they make today might impact them in years to come. What if we made it our job to create a generation of Canadians who have the tools and the know-how to enable them to understand and interpret health information, but also to make informed choices about care decisions, considering things like costs and risks and what they can really expect from a given intervention? Would this new proficiency allow them to be part of a new conversation, not only about what we do and how we do it, but about their role in this, their responsibilities, how they navigate difficult choices, and how together we can design a new future for healthcare in Canada? Let's have the courage to start a new conversation. Just think about it. What would be the impact on quality and patient experience? What might happen to the health of our population if we break down those walls and engage our patients differently? Would this new conversation generate even greater expectations or allow us to use scarce resources more wisely and achieve better value for all? My third hope for healthcare is that we have the courage to accept patients and families as our partners, that we strive to share knowledge and create tools that allow them to be actively engaged in their health and co-create the system of the future together with us. As a clinician and healthcare leader, this takes me way out of my comfort zone. We will all have to be brave because it's the right thing to do. And finally, how do we understand the value that we represent as a system? Is it about the experience of people in our care, how much it costs, or the outcomes achieved? What if instead we thought about value in terms of what we invest to help people achieve their personal health goals? Let's define our success as helping people to achieve their healthiest possible lives. I doubt that we would stop doing all the cool stuff that we do every day, but we might not confuse it with doing more of it as necessarily doing better. And we might develop a new appreciation for things that aren't in our repertoire that could have a real huge impact. Think about it. Is it possible to spend less and achieve more? I think the path forward demands it. So my final hope is that we reframe value from a measure of how much we do and how much it costs to what truly helps people achieve and sustain health. And in doing so, we appreciate that how much we spend on something often has little to do with how much impact it has, and therefore its true value. So there you have it, my hopes for healthcare. I hope to reignite the passion that brought us to healthcare and remember the privilege and joy of being caring professionals. In embracing that passion, I hope the founding values of healthcare can guide us as we face the growing complexities in our system and move boldly and courageously into the future. And last but not least, but perhaps most importantly, partnering with our patients and facing the future together will help us reframe value and focus on what it takes to truly sustain health. This is our time, and we as leaders can seize the opportunity to make a difference for our patients. We need the courage to think outside of the box and the focus to deliver real change. Together, I know, we'll forever transform the Canadian healthcare system. Thanks for taking that first step with us tonight.